Module 5, the preschool child. In the preschooler, their social circle is beginning to enlarge. Their language, play patterns, and appearance change markedly. Curiosity and ability to explore grows, but sometimes they do have problems separating fantasy from reality. Per Erikson, the major developmental task is initiative versus guilt. These kids try to find ways to do things to help, but they might feel guilty if they're scolded when they fail because of inexperience or lack of skill. When we're gathering information on these kids, include the preschool child and the older child in the interview. Use those age-appropriate questions and be honest when you answer their questions. Use stories and books as appropriate and listen attentively to the child's comments. It helps them feel important. When we collect that objective data, this is the directly observed information, including their height, weight, vital signs, and exam of body systems. Again, this does not usually proceed in a head-to-toe manner, and we need to consider the child's age and development. Different aspects that might be more traumatic and uncomfortable we save for last. This does include the nose, mouth, ears. Make sure the family caregiver is available. Let them be present and let them assist if they want to. Respect the child's privacy and cover until a specific part of the body is examined. Take all of that information you've gathered and document it appropriately in detail, paying special attention to the area that they have complained about, and then develop that plan of care. As far as their vital signs, make sure that with their temperature, you're using mercury-free glass thermometers, electronic tympanic membrane thermometers, or digital devices. The 4 to 6-year-old can use the oral temp because they're conscious and cooperative. However, don't leave them unattended. With the tympanic thermometer, this does provide a rapid response. It's non-invasive, it causes little disturbance. It can also be used on a sleeping child. The temporal thermometers uses that infrared sensor probe on their forehead, and heat from the temporal artery helps provide the heart rate. It's non-invasive, but if the child is sweating, that can affect accuracy. Count those respirations during a quiet time and watch for retractions that can indicate respiratory distress. If the child is 3 years of age or older, then get the blood pressure, making sure that you explain the procedure and possibly demonstrating on a doll or stuffed animal. Use the right size cuff and allow the child some quiet time before you obtain that blood pressure reading. If it's abnormal, check it at least twice, making sure you wait at least 1 to 2 minutes. The normal pulse rates for children, blood pressures for children. The preschool's physical growth is now going to begin to slow. They gain about 4 to 5 pounds every year and about 2.5 inches to 3 inches in height. The boys are going to tend to be leaner than girls. They start developing gross and fine motor skills, and they develop pretty rapidly. By age 5, generally, they can throw and catch a ball and climb effectively or ride a bicycle. Check out Table 25.1 in your textbook. Their teeth, by 6 years, their skull is 90% of the adult size, and the deciduous teeth have completely emerged. Toward the end of the preschool stage, they're going to start being replaced by permanent teeth. But timing will vary among different ethnicities and different economic groups. Their visual development is still immature at age 3. Eye and hand coordination is good, but judgment of distances is generally pretty faulty. Their vision should be checked to screen for amblyopia. They will generally achieve 20/20 vision by age 6. Mature depth perception might not develop until they're about 8 to 10 years of age. Between 3 and 6 years, the greatest amount of skeletal growth will occur in the feet and legs, which contributes to a change from that wide-gated, pot-bellied look of the toddler to the slim, taller figure of the 6-year-old. The carpals and tarsals are maturing in their hands and feet, so they also have better hand and foot control. As far as psychosocial development, they have a rapid language development and an amazing imagination. They start having sexual and social development and a variety of types of play. So between the ages of 3 and 5, language development is generally rapid. Most 3-year-olds can construct simple sentences, although their speech may have some hesitations and repetitions. By the end of 5 years, they use long, rather complex sentences. They use language changes. They might talk to themselves or to their toys. Piaget says this is egocentric or non-communicative language. The 4 and 5-year-olds might use those naughty words or swear words. Delays in language development or other difficulties might be related to hearing impairment or other physical problems, a lack of stimulation or overprotection, or a lack of parental interest or even rejection by parents. So it's important to regularly engage the child in conversations. And one way to do this is read to the child. It helps them develop their language. And be aware of potential cultural patterns, bilingual families, and different dialects. These children have magical thinking, and it can make it difficult for the child to separate fantasy from reality. They believe that words or thoughts can actually make things happen, makes it real, and they often have imaginary playmates. Their imagination leads to a fear of dark or maybe nightmares and can result in sleep problems. Caregivers need to acknowledge these concerns and be patient with the explanations and offer reassurance to the child. Sexual development. Freud says this is Oedipal or phallic, period. A preschooler's sexual curiosity and exploration of his or her genitalia is normal. So a calm, understanding family caregiver can help the child develop positive attitudes about him or herself as a sexual being. We need to teach them about good touch and bad touch. Counseling might be needed, though, if the child is showing excessive touching activities. With their social development, we look at their play. This is how children learn. They have imitative play where they pretend to be someone else, dramatic play where they act out troubling situations, cooperative play, which is organized groups or team sports, and dissociative play where they play together without organization. Parallel play where they play alongside each other, but they're playing independently, not with one another. Or solitary independent play, which is playing by themselves. Onlooker It, for example, would be watching television. An occupied behavior would be daydreaming. These kids should be encouraged to draw. It helps develop their fine motor skills. They do need all kinds of play um, to help develop appropriately, but we need to understand that too much of the onlooker play can result in highly inaccurate impressions of people and appropriate behaviors. The time that they spend watching TV or on electronic devices should be limited. We may see aggression in this population with temper tantrums, name calling, and threats. They might push, hit, or kick someone as they get older, especially around age 4. Normal reaction must be properly handled. If they come from an unhappy home situation, aggression is more likely to increase. Discipline should be teaching a sense of responsibility and inner control. Caregivers have to understand and agree to limits and discipline measures. The child is going to learn to play one against the other if the caregivers disagree and handle similar situations differently, such as mom might say no, but if I go to dad, he'll say yes. Taking away privileges when the child misbehaves might be the most effective discipline method. So check out Table 25.3. Preschool or daycare experience can help provide group experiences and help deal with transition, although transition might be threatening to some children. So a gradual introduction to changes can produce most satisfactory adjustments. The more time a child spends in a facility means the more time the child is going to want to spend with caregivers when they come home. However, these facilities can gradually increase the child's independence. The disadvantaged child, though, may not have achieved a sense of security and trust and might require special understanding, warm acceptance, and guidance. Environmental enrichment is often unavailable in families that have limited social, cultural, and economic resources. And this is what led to the program called Head Start. Caregiver participation is going to be a central component, and home visits, counseling, referral services are provided in Head Start. It helps improve outcomes in some of these disadvantaged kids. So, question: what age group delights in using swear words? The 4 to 5-year-old. Next question: true or false? Play is an important part of the preschooler's life. Preschool children who spend time playing interactive video games are said to be engaged in onlooker play. This is false. Children at this age do not need large quantities of food. Their appetite is going to be very erratic. They need about 1,200 to 1,800 calories a day with all of the food groups. Excuse me. Again, that erratic appetite where they eat everything at one meal and maybe just a few bites the next time around. They might need to have supplements. They do prefer plain foods over those mixed foods. Culture can influence their food choices, and food should never be used as a reward. Excuse me. Preschoolers have definite food preferences. Try and introduce new foods, one food at a time. These kids are showing independence and skill in eating at this point also. So with health promotion and health maintenance, excuse me, make sure that immunizations are up to date. The DTaP, polio, MMR, varicella, they require annual health exams to monitor their growth and development and screen for potential health problems. Recommended screening procedures would include a UA, hematocrit, lead level, a TB skin test, and the Denver Developmental Screening Test. They need vision, hearing, and dental screenings. Make sure you talk to the child in advance about any upcoming exams. With teaching, these kids still need continual supervision during bathing. The caregiver would handle the faucets and set the water temperature, assisting with the ear, neck, faces, hair, washing. And the caregiver needs to set time limits. Make sure you teach the child how to properly wash their hands. Give these kids the opportunity to choose what they want to wear, and the family should accept the child's choice without negative comments, whether it matches or not. If choice matters, provide the child with limited choices. As far as dental care, they still need supervision and encourage healthy eating and the use of fluoride. They're still going to have toileting accidents, and we need to treat these as matter of fact. Teach the girls to wipe front to back, hand washing, and understand that bedwetting is not uncommon. These kids are ready to begin giving up their naps. However, we should encourage a period of quiet activities or reading before bed. Understand dreams and nightmares are common, and they might still have a fear of the dark. Question: bathing is still a fun time for most preschoolers. Many exciting times can be had splashing in the tub with favorite toys. What temperature should water heaters be set at to maintain our in order to prevent accidental burns? 120. And now for the post test.